Hi guys, and welcome to another episode of Kabir Considers. In this video, we're going to react to UK versus US healthcare from the perspective of somebody with diabetes. Now, this is going to be really interesting because, this is a condition that a lot of people have, but both countries, the UK and the US, tackle things in a very different way, even though we both spend, like in terms of the government, a lot of money per person. I think last I heard, the UK government spends like 7,000 a year per person in terms of healthcare on average, whereas the US is like 10,000. So the US spends even more. However, we have a national health service, whereas in the US you need private health insurance. So this is going to actually be really illuminating for me to show the actual numbers. What does somebody with a condition like this have to pay out of their own pocket, in both countries?
So some of you may know I spent most of my adult life in the UK and I'm a British citizen. So I really only had experience with the NHS in terms of my adult interaction with taking care of my health. And a lot of you guys have asked, what has it been like, that transition? And, well, hard. First of all, the big difference, you come to the end of your appointment or your blood test or even before these items, and it's money, please. You better have some money. And that may sound obvious, but it is so much more pervasive than just the act of handing over a credit card or paying your...
This has to be in the US, right? Because in the UK, you don't have to pay anything at the point of service.
Insurance bill every month. You
US.
Feel like the healthcare here is a class system. And I think that's simply because it is. Like, you go through these different insurance packages and maybe they're like bronze, silver, gold, platinum. That's literally how you can filter them on the side of the screen.
Platinum insurance.
And I mean, yes, they're signifiers to denote how much coverage you're going to have, or your, I don't even know, your deductible shenanigans. I can't even try to stay neutral on this subject. I think it's fucking ridiculous. I know the NHS is not perfect, and I know the UK and the NHS in general have been in and continue to be in a lot of trouble. So I'm not just sitting here being like, they got it all figured out and we're screwed up here. No, that's not what I'm saying. But in terms of a care for your people, all I can say is in the UK, I felt universally cared for. And here, I feel like if I have the funds to pay for care, then I'm allowed to be healthy. So easily number one, the most confusing thing has been navigating what insurance to get. Luckily, through my job, I'm self-employed, but I get insurance through my job, sort of. It is pretty much, you get this package and that's that. So I didn't really have to choose so intricately. Number two has been finding the right doctors. Your choice in doctors. In the UK, your GP pretty much does everything. They see kids, they see adults, they see asthmatics, they see people with...
Yeah, so basically if you go to your GP and, you have, let's say, a skin issue, they will then refer you to a dermatologist. Like, you don't have to, you can choose one, but then you have to do that privately. But then if you want to rely on the NHS, you'll get sent to a dermatologist. You won't have to choose one based on their reviews and stuff like that. Whereas in America, you probably have more choice.
Mental health conditions. That doctor has the power to treat all of those things, to prescribe you antidepressants, to prescribe you an inhaler, to treat a baby and an elderly person. And this is all I ever knew. So I had an endocrinology team and I had my GP. That was pretty much it. Every year I'd go for an eye exam where they'd screen my eyes and take scans of my retinas and all that stuff to make sure there wasn't any degradation in my eyes due to diabetes. But that was...
Wow, so diabetes can affect eyesight. I did not know that. Wow, okay, interesting.
Pretty much it. Here, I have spent so much time registering with different doctors. So much so to the point where I finally registered with the GP, or your primary care physician as they call it here, and I was like, okay, great. I'm diabetic, so I need my insulin prescription. And she just said, oh, no. Like, I don't prescribe insulin. Absolutely not. You have to go to your endocrinologist for that.
What?
So I did have an appointment with my endocrinologist, but because he was, a good endocrinologist that had a waiting list, I couldn't see him for like 3 months.
What? Nah, that's crazy. Is that really the case? You have to wait months just to get an appointment to get a prescription for insulin. I mean, this obviously might be unique to her, but still, I don't think that's on. Because, insulin is something you need to take daily, no? As a diabetic.
So I was like, oh, what do I do?
Yeah.
And I was also so shocked that the primary care couldn't prescribe insulin. It was totally
But why can't
categorically unwilling. So that has been a big shock to me, in that in order to get the treatment that I need, I have to go to all these different doctors, and every doctor has somewhat of a different system. So, you go in, you fill out the paperwork, you go through all the initial questions, and then they want their own blood work, which all costs money. And yeah, at the end of all these appointments, money please. You gotta.
So hold on, every time you go to a doctor for an appointment, you have to pay in the States. But doesn't the insurance cover that? Surely that's what the insurance pays for. Can someone give me a basic rundown as to how an American insurance policy works, and how much it would cost for a 30-year-old guy,
Have the money to pay for the insurance, and then you gotta have the money to take time off work to go see these various different doctors, because they're different places. The transport to get there or the transit time to get there is different. It just demands so much of a person, and you have to be so organized and on top of it, which I always thought, in the UK, if you're your own advocate, you can get the care you need. And I still believe that, but you would always be getting that through your general
GP.
practitioner
Yeah,
for the most part. Whereas
Is there a way for you to have a GP in America that can deal with everything for you? Can prescribe anything, obviously, if you need it. Is there a way to do that? Rather than having to visit, a specialist doctor for every single thing? Is there a special kind of insurance for that?
in the US, I feel equally, if not more, the need to advocate for myself, because you're choosing doctors from a directory of 1,000 different options, which sounds great, and there is a plus to that, but it's also incredibly complicated and confusing and time consuming to look up all the reviews and make sure you're choosing a doctor that is going to be good for you. The other thing I think is a very dividing factor that I've seen is the amount of time you need to be able to devote, yes, but also savvy, smart nature you need to have to know that, for example, I can go to this pharmacy and I can get a better rate there. My insurance works best with this pharmacy, or sometimes I should use my insurance for this prescription, but other times I should use a coupon or a good RX, that is actually going to make that more cost effective. You need to be constantly on the alert and bobbing and weaving through these different options to be savvy to make sure you are getting the best deal. Which, I'll be honest with you, deal and healthcare
Shouldn't go together.
These are just concepts that in my adult life have not been alive in my mind. And I know I'm very, 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 very lucky to say that. But I feel like you need to be pretty darn educated and have the confidence to call places up and to use coupons that you might not be sure are going to work. Or
Coupons? Wow. So discount health and things like that. Nah, man, this is... I don't know. The NHS is, it has problems for sure. For sure. It's not as good as it used to be, but I definitely prefer the system here. You pay a percentage of your income. I think it works out to 9% a year. And pretty much everything is covered, apart from cosmetic and dental. That's it. It's just simpler, I think. It's just simpler. Like North Americans watching this, so Americans, Canadians, I think Canada has an NHS actually. Like, would you prefer an NHS style system or would you rather keep what you have?
Advocate for yourself when you know it's right through the insurance, but the person providing isn't providing the same thing that you were told you were going to get. These are all things that the consumer here really needs to have if you're going to get the most bang for your buck, I guess, which don't we all want that? Especially when you're dealing with a chronic condition that you have many different medications that you have to keep renewing every single month.
Yeah.
You want to make sure you're doing like the smartest thing possible. So we relocated about a year ago, and because of this being a whole new system to me, I am only just getting to grips with things and getting in place a structure of how I'm going to get my medications every month. And I really don't mean to sound like I'm complaining or bashing the American healthcare system, but this is just what I've experienced and a genuine comparison to what I experienced on the NHS in the UK for the last 15 years. And I should say, as an addendum to the it's free in the UK, the NHS is a taxed system. So I believe it is about 20% of the people's income tax goes toward the NHS.
20%. Okay, right. So a fifth of the tax we pay. I guess.
Don't quote me on it, but I believe that's a general gist. So you are paying for it in a certain sense, absolutely. But it's in alignment in terms of the percentage to your own personal income taxes. Yeah. And a lot of people have a big problem about that because then the more wealthy are funding it more so than the less wealthy. And I hear that, but from an ethical and moral perspective, I personally find that to be a more suitable way.
Yes, I think so. Because I think if you're wealthy in America, you can probably get healthcare far superior to anything we can get in the UK. No doubt about that. Like, if you have the money, you can get the best doctors in the world, which is great. But the majority of people are not wealthy. Like, the majority of people are middle income earners who cannot afford that. So for those people, I think a national health service is superior. You know, that's just my personal belief. Like, what do you guys think?
To care for a public. And if I'm paying more than people that are less fortunate financially, I'm really okay with that. But I understand that that can be a very divisive subject, and I get it. But I'm so certain of where I stand on that front that I'm happy to say it. And if you want to come at me in the comments, that's fine. Moving to the US, I always knew this. And it was a factor I had to get to grips with when we decided to move. And it's so much more complicated than I could ever have understood watching US bloggers and whatnot talk about it. You can hear people talk about this, but it's not till you're really in the thick of it that like you realize just how complicated and overwhelming it is. This isn't meant to be a bash on the US system. The quality of care that I've found has been excellent.
Yeah.
It's just the way, the route to get to that care.
That's hard.
And what you need to have access to that care bothers me a lot. And I'm lucky because I have the capability to do what I need to do and pay for what I need to pay to get access to what I need to not only survive, but like thrive and live a healthy life. So I fully stand up and appreciate that as well. Like I say, always, I wish you great blood.
Great. Brilliant video. Fantastic video. I don't understand though why, you're like you can't get certain prescriptions from one doctor. It would just save so much time, so much money as well, rather than having to send, people to this specialist or that specialist. But then I suppose you could argue that that's how those doctors maybe make their money, I suppose, because they can charge for an appointment. It's a fascinating topic. I do think that, there's probably a better way that the American government can handle healthcare. probably a way that's cheaper as well. Like if you have a centralized system that purchases medication in bulk, like the NHS buys, medication in such huge volumes that it can get deals. Therefore, it doesn't have to charge the end consumer a huge amount to cover the cost of that. Like to get a prescription on the NHS is £9, and that's for anything. Like any prescription you need is £9 because the NHS can buy, billions worth of a certain product, for a fraction of what it would cost if you were buying a smaller volume. Like, I think, an NHS service. Doesn't the US have some kind of NHS service? Isn't it Obamacare or something? I don't know whether that was rolled back, but yeah, let me know if you guys would prefer an NHS system in the USA or if you'd rather keep what you have there. And let me know how much you pay for your health insurance and what do you get for that. Thanks for watching, guys. If you enjoy my videos, please help me out by liking and subscribing.